Hi, and welcome to another Waterbury Health podcast. I'm your host, Jeremy Rodrigo. Joining me today is the medical director of our endocrinology, diabetes, and metabolism office, Dr. Anna Ziganshina.
Hello, Jeremy. Thank you for having me here.
And I'm glad that you're here because it is World Diabetes Month this month in November. And we also have like the holidays coming up and stuff like that. So we're going to talk a little bit about nutrition and diabetes and things like that. All the things that are important to know about healthy living, right?
Yes,
and
exactly.
diabetes.
Yeah.
So let's talk about how to prevent diabetes and how to eat healthy and some of the things that people can do. And especially, this is especially important when we're coming into the eating holidays.
Right, right.
We're eating things that maybe we shouldn't eat or we eat too much of and things like that.
Exactly. So to prevent diabetes or to manage diabetes when you get it, I think it's very important to first realize what is diabetes.
Mm-hmm.
And really the story of diabetes is the story of pancreas and sugar. So pancreas is the wonderful organ that sits in our abdomen and makes a hormone called insulin. And insulin is needed to digest, to metabolite all the sugar that we're getting and that is made into glucose in our blood. And the sources of glucose are actually everywhere. It's almost everything we eat, but primarily carbohydrate-rich foods like, for example, pizza, bread, rice, pasta, everything like that.
So sugar isn't just
Sugar,
right? Sugar is in a lot of things.
Sugar is everywhere.
Right.
And we need it, but in the modest amounts, and we usually exceed that. So diabetes is occurring when there's imbalance between how much sugar we consume and how much insulin can pancreas make. And this can happen from either pancreas failing, not making insulin because there's a disease in it. For example, this is usually that is often referred as type 1 diabetes, when pancreas is not able to produce insulin, or when we just have too much sugar, too much carbohydrate-rich foods.
Yeah.
So, and from understanding this, follow the principles of what to do to either prevent or to manage your diabetes when you have it. So, and there's really so much that can be done. Fortunately, nowadays science has advanced significantly, and there's so many medication classes, so much available. But it really starts not with medications. It starts with changing your lifestyle and changing your eating habits. Again, this is another huge topic for many, many podcasts. But I was reflecting on it yesterday of what could be the easiest to follow, just a couple of advices that we can give to ourselves and to our patients and to our families. So, and I came up with something that I called Eating Smart. The acronym SMART will stand for S, start early. What do I mean by that? We really need to start leading young minds around us, leading by example primarily. I'm talking a lot about our children or any young people around us, and to show them and to teach them healthy eating habits so that these can become their core habits. Yesterday, we were sitting with my daughter eating pomegranate seeds, and she was sharing her day with me. We're really enjoying this moment. Yeah. Chances are she will be eating pomegranate later in her life, so that I was raised eating pomegranate. So it's a great, healthy, really nutritious superfood. The same way, pizza is oftentimes our comfort food for so many of us, because this is how we grew up. There was a pizza day in the school, Pizza Friday. There's never a pomegranate Friday or salad Friday in school, right?
There's never salad Friday.
There's pizza at all the, there's never salad Friday. There's pizza at all the birthday parties that kids have so many core happy memories. So whenever we're stressed or just any time during the day, we return to our comfort food, which is pizza. So think of what you introduce young minds around you.
And so something like a pomegranate seed, it's it's healthier, it's got better fats and better calories to intake instead of eating a bowl of Cheetos or a pizza or a candy or whatever.
Exactly, right. Pomegranates is actually a really great example because oftentimes we get used to some foods because of their palate properties.
Yeah.
So they have to be crunchy. That's why we like chips. And pomegranate seeds, they give you this crunchiness. So it's really a lot into how we get really, how we turn to like certain food groups. So next measure in SMART acronym is measure and mindfulness. So by measuring, I mean to really try to measure how much you eat of certain groups. For example, if we're talking pasta, you really should not eat more than your fist of pasta, and usually that's not what we put on our plate.
Right.
Or what you can do is you can use this so-called Harvard plate, that gives you a very nice example of how to portion your different food groups. This largest section, what do you think should be taken by?
I'm going to say, because you're a doctor and you're here, something healthy like vegetables.
Exactly, right.
Yeah.
It should be vegetable, and so those small groups, the small sections, this would be your carbohydrates, and here would be your protein. Yeah, so, and it's easy. You can buy this and reuse it, or you can buy disposable ones, and even places like Stop and Shop. Or you can really weigh your food when you eat.
Yeah.
And then the second the second description of M in this measure would be mindfulness. So we really need to try to think of each meal as a moment of mindfulness. So we should sit down, pause, appreciate the food that is in front of us. Don't try to eat and chew on the go. Just pause and really be in the moment. This way, satiety comes much quicker than if you do it while
Yeah,
doing
because so
something
many
else.
of us are on our phone, scrolling through things while we're eating and not being aware and cognizant of what we're eating, and so we tend to overeat. We're
Exactly.
eating way too much.
Exactly, because your mind participates in this feeling of satiety, and if your mind is occupied by something else, you will not feel it. You will not be able to feel it. So, and the next is R. It means read labels.
Mm-hmm.
So we rarely pay attention to what's written on the labels, and we don't even know what are we consuming, what are we eating. Oftentimes, if we just read what's there, if we will see that this product has 500% of recommended daily dose of carbohydrates, we oftentimes will maybe not even choose that.
Yeah.
But if we don't know, we will unlikely say no to something that.
Yeah, so if you take a few minutes and read the label, and they're looking at recommended daily allowance of
Right.
carbohydrates and sodium and everything else, like, whoa,
Yes.
that's way more than I should eat. Maybe
Exactly.
maybe I'll pull
Yes.
that back.
Yes. And the other very important point to pay attention is to what is the portion size in this product.
Yeah.
So if they tell you that this product has only 15% of daily value of carbohydrates, but this will be in 3 pieces of, say, chips, and we are going to have the whole bag, which contains like 100 pieces of it.
Right.
So that's important and easy to follow. And the last is timing. Timing really matters. It is very important to try to shift the calorie-dense and carbohydrate-dense foods to the earlier hours of the day so that we can sort of walk off those calories versus try not to eat all day or being busy to eat all day and then eat a really heavy, dense dinner 7 p.m., 6 p.m. So same thing with pizza. Many of my patients like pizza, and I tell them, okay, have it, eat it. But it's better to eat it in the morning rather than have, or morning pizza is not a common thing, maybe for lunch rather than move it for the dinner.
Yeah.
And I think I didn't include, I forgot to mention a very important part of the SMART algorithm. A stands for achievable goals and add before subtract. So don't try to tell yourself, okay, starting from Monday, I'm not going to ever have a bite of pizza in my life. That's just not going to happen.
Right.
Rather, try to set achievable goals. Okay, I will only eat pizza once a week and not more than that. And also, A stands for add before subtract. Again, going back to pizza, try maybe instead of saying I'm not going to eat any more pizza, but supplement pizza with a nice portion of a crunchy, delicious salad.
Yeah.
This way you will eat much less of pizza without actually having to say no to it at all completely.
Yeah. That makes sense. And when you put it into like easy to understand principles like this, I think it makes it easier for people who don't want to work at it.
Yeah.
Right.
It often makes it easier, but I have to admit, working on your diet, on your lifestyle, in general, it's not an easy task. And this is how I think of diabetes and how when I try to put myself into shoes of my patients with diabetes, I really just have so much admiration and so much respect for them, because diabetes is something that you cannot take a break from. You cannot have a Thanksgiving break from diabetes or Christmas break from diabetes. You cannot you can have a weekend without thinking of your diabetes if you have it. You never can graduate from having diabetes. It's something that's always with you, and it impacts your daily life, your daily decision making. So some people really do tremendous and achieve tremendous success with being mindful of having diabetes and having imbalance between insulin and glucose in their blood.
So yeah, so once you're trying to manage diabetes, you're doing it correctly. It is a mindset and it is a lifestyle.
Right.
And it's always going to be there.
Yes,
right?
Exactly. Yes.
So I think these are important. So, but what's also important is trying to prevent having diabetes, right?
Mm-hmm.
And so a lot of that is good eating habits, good lifestyle habits, maintaining a good healthy body weight.
Yes,
right?
yes. And again, a lot of that is set into thinking of society and society norms and what is easy to follow living in our society. For example, when we try to take stairs going somewhere, it's very hard to find stairs. Normally, they will be hidden somewhere. They will be dusty behind some scary door that you don't even want to open. But the elevator is always right there.
Yeah.
So it's hard to promote more exercise, more movement, if everything is set for moving less.
For ease and doing less and making it more convenient. I try to park farther away at the store.
That's a very smart
I try to park farther
option.
away on purpose, just to force myself to walk a little bit farther. Mm-hmm. But a lot of people don't think like that, right? So it's just let's park closer, it's more convenient, whatever. I'll get in and out faster or whatever. So now we're at the holidays though, right? And so this is the time of year when we're going out to eat and we're going to parties and we're presented with this quandary, right? We're going into a restaurant. How do I follow my smart eating principles at the restaurant? How do I do that?
Right, and I think it's very smart that Diabetes Month is November, right? As we're coming into Thanksgiving feast, Christmas feast, all of those celebrations. And yes, you can be mindful of diabetes while attending all those outings with your friends and family. So, and there's one, I came up with one for restaurant eating as well. And I call it a happy restaurant eating because I'm always happy when I go to the restaurant.
Yeah.
So, and here we start with H, which stands for hydration. It's every time we come to restaurant here in this country, we always present with this nice cold glass of water. So really focus on try to drink as much as possible of this water because this will help control your hunger and will likely prevent your overeating. So drink this water, don't put it away. Then in happy is A, which stands for skip appetizer, and I ask for salad. Appetizers are usually very calorie dense. They usually will increase your glucose quite significantly. So try to not to eat it, and instead ask for salad, which is starting with fiber is a great way to slow down the absorption of everything, of all the carbohydrates that will enter your stomach. And also another very interesting tip for having salad at the restaurant is ask them to put the dressing on the side, to bring dressing on the side, because many of us will not need dressing in the salad at all, or even if you will put some dressing, you can put much less than
You'll put
usually
less than the restaurant would,
than
but
yeah,
they're
that the
just gonna
kitchen
glob
will
it
do.
on.
Right. So then it's P, and it says postpone bread. Every time in the restaurant they bring this delicious, freshly baked out of the oven bread, and we usually eat a lot of it with butter. So it's really better to eat it after entry,
Because chances are, after you've had the salad and the entree, you're going to eat less bread or no
probably
bread at all.
yes, no bread at all, right? So don't really get heavy on that. So and then P, another P stands for portion control. Here our portions are usually so generous. So when you order your main course, see if you can ask, split that main course into two, and then you can even ask to pack half of it right away to go, or right on your plate, just split it into half, set it aside, and only focus on eating one half of it. And then lastly, Y stands for why dessert. So dessert is always a fun part of the meal. It's usually beautifully presented.
That looks great.
But we're usually so full by the time dessert comes, so maybe why having it?
Right.
Or if you have dessert, one thing I find very helpful is ask not to put whipped cream on top. I think 95% of desserts here come with some whipped cream on top, which we don't need. There's such an unnecessary calories. Or if you have dessert, maybe see if you can share it between 2 or 4 people at the table. So you have this way.
Because you're going to get a little of the
little
sweet,
bit,
but
yes.
you don't need the whole,
You don't need the whole.
huge piece of cake. Right.
Right, exactly. So, so I think we'll have a great chance to try out those principles and see if they work out for us this holiday season.
Yeah, I think that's it. Even if we make it into a game, right? Let's use the happy restaurant eating, or we'll use the smart eating principles, and we'll make it into a game and see if we can. Because a lot of people, they eat the food because it's in front of them, right? There's a huge portion. I'm eating it because it's here. I'm not eating it because I'm hungry anymore.
Exactly. Yes.
I'm eating it
Oftentimes
'cause it's there.
it's a peer pressure. Somebody else is eating around you, and say, "Oh, let me try that too." Oftentimes it's a stress eating, and here we go back to our comfort eating that comes from childhood. So a lot of the times it's just trying to replace those habits by something achievable, but working.
And these are great principles, and it takes it takes some doing, and it takes some willpower, and it takes focus to do. So now that we're there and we're starting to eat healthier and less, we have diabetes. We have medications that are out there managing diabetes. Tell us about some of the medications that are out there and some of the magic things that we see out there, like Ozempic and some of these spas that are out there. So tell us about some of the pitfalls and dangers that might be associated with those things.
Right. It is truly amazing to realize how far science advanced from the time that diabetes was first discovered, and then from 1921 when insulin was first invented, but really not available to anybody. And now we not only have so many different types of insulins, but we also have so many non-insulin diabetes medications that not only lower your glucose values, but also prevent complications of diabetes, because diabetes is really not a disease of your blood glucose. It's the disease of your heart, of your brain, of your vessels, of your kidneys, of your eyes, of your limbs. Those are all the target organs when diabetes is not treated properly. So it is probably one of the most exciting groups, relatively new drug classes in diabetes care are so-called GLP-1s. The one that you mentioned, Ozempic, is one of the famous representatives of it. So those stand for glucose-like peptide-1 agonists, and this class is truly not only very effectively lowers glucose values, so control diabetes, lowers A1C parameter, but they also help lose weight very significantly. They showed in their studies that the weight loss with GLP-1 agonists can be over 20%, and that's a lot. No other weight loss class of medications was able to achieve that significant weight loss. They compare it with bariatric surgery at this time, the efficacy of weight loss.
Yeah.
So Mounjaro, with the generic name of tirzepatide, and Ozempic, generic name semaglutide, are the most famous classes, most famous representatives. They are really helpful, very effective, but they're not magic pills, how people think of them oftentimes,
Right.
and trying to do everything to get them. First of all, many patients will actually not be able to tolerate them. Many of them would have side effects. By this I mean really intolerable nausea, even vomiting, really discomfort, significant discomfort, constipation or diarrhea. Some of these side effects can be very significant, and people are not able to continue with these medications. Also, people often think that you will lose weight in a blink of an eye as soon as you start. No, those numbers, 20% or more weight loss, that was shown at the mark of 1 year, 52 weeks, to lose all that weight. And also, not everybody will lose that much. I do have many patients, and we all know that some of them use those GLP-1 agonists for a long time, the highest dose, but don't lose any weight. Some people lose more, but there's always an average.
Yeah.
So
it's not magic and it's not guaranteed.
It's not magic, it's not guaranteed. But really, Jeremy, what's very important is what you mentioned about being very careful of the sources of your medications. So you only can get Ozempic, Mounjaro from the pharmacy, from the official pharmacy like Walmart, CVS. You cannot use compound pharmacies or medical spas that offer you Ozempic, or they call it like Ozempic or semaglutide, because Food and Drug Administration does not control them. You cannot be sure what exactly you're getting every time you get this vial. You cannot be sure if it was made in a clean, controlled settings. So
these are substances, chemicals that you're putting into your body.
Yes, this can be dangerous.
That can be really dangerous, and getting them from a licensed pharmacist as prescribed by a doctor is really important.
Yes, yes.
So although the spa or the what do you call it, compound pharmacy?
There are compound pharmacies, yes.
May look nice and clean,
yes,
and
right.
they're not regulated.
They're not. That's the most important part. Nobody is overseeing them.
Yeah, and that could be really dangerous, especially when your doctor is prescribing something, they know everything about you, all of your, past medical conditions and allergies and all these other things. You may be going to someone who is running a spa that doesn't know all about you.
Yes,
and that could make it even worse.
And there are certain conditions that would make using GLP-1 agonist really quite tricky. For example, there is a condition that is seen not so infrequently with diabetes. It's called gastroparesis. When your stomach is not moving as quickly as it should, and it's often seen with type 1 and type 2 diabetes. So in those situations, GLP-1 agonists can exacerbate it, can move your stomach even slower, and that can be quite dangerous and uncomfortable for the patients. There's a relatively rare type of thyroid cancer, medullary thyroid cancer, in which situation, if there's a family of this condition and a family history of this condition, again, better not to use GLP-1 agonists. And even this is seen a lot if patient with diabetes has very significant eye disease, diabetic retinopathy. Oftentimes you have to be very thoughtful and think 3 times, consult maybe with ophthalmologist and endocrinologist at the same time if it's okay to use GLP-1 agonists. there's a lot of nuances into that.
There's a lot to think about, and
A lot.
this is why it's really important that you have a doctor, especially like you, a specialist,
Yes.
that's managing this.
Yes, and the primary care physicians here in our community are also very, very well versed and very educated in this, and they know. So it's, but not compounding pharmacies, medical spas, or
Right.
whatnot.
They're just taking advantage of this new.
Of the situation when it's so unavailable for.
Right.
for
Because
many
Ozempic
people.
is everywhere, right? People are like, Ozempic, is like it's magic and it's gonna solve all your problems. You don't have to do any diets anymore, and that's really
Yeah.
not the case.
That's not the case.
Yeah. So it is World Diabetes Month, and you're taking care of all of our diabetic patients all over the area, along with our primary care physicians. Is there anything else that's important for you to share with our audience?
Well, there's so much to think about. I think what is important is for people with diabetes to really appreciate how strong they are and to really appreciate themselves in making good decisions for themselves, making smart eating choices for themselves every single day, and to really reward themselves and congratulate themselves for every small success they do along the way. You didn't have that extra cookie today. Pause and think and congratulate yourself on
Right.
that.
Consider that a win.
You didn't forget to take your medication that evening. Pause and say it's great. So don't really focus on blaming yourself for not being a perfect patient, a perfect person with diabetes. Think of the positives you achieve.
Yeah,
I think this will take you a long way.
This is a journey. That you're
Yes.
dealing with.
Yes.
The whole,
This is a journey, yes, and consistency definitely wins the race. But in order to be consistent, reward yourself for your small wins.
well, Dr. Anna Ziganshina, thank you so much for joining us on the podcast today during National Diabetes Month. This is important stuff. Dr. Ziganshina is the Medical Director of Endocrinology, Diabetes, and Metabolism right here at Waterbury Health, with an office on Straits Turnpike in Middlebury. Thank you for joining today. We really appreciate you taking the time.
Thank you.
Until next time.